all over the country in not all 50 states, but many of the 50 states. Your state legislatures are convening as well. And you may not know that Family Research Council is part of a national network connected with state organizations that work in the state capitals that do the exact same work, fighting for family, faith, and freedom. If you are not connected to the state organization where you live, you can find that organization by going to frc.org/states. And you can click on the map there, find out where you live, find out the local state family policy council that is fighting for faith, family, and freedom in your state capital. And you can connect with them, and you should, to stay in touch with everything happening in your neighborhood, as well as what you do, keeping track of what's going on in Washington, D.C. Hope you will check that out, frc.org/states, and be part of what's happening in your state capital in 2022. Today on the program, we've got a great lineup for you. Is the Biden administration making plans to place men who identify as women into women's prisons? A leaked draft rule suggests that could be happening. In addition, college swimming is the latest battleground for the debate over transgender sports. A Penn swimmer is making waves and crushing his opposition, but he just lost a race, and that's kind of important too once you find out who he lost to. At the end of the program, Russia is lining up troops on the border of Ukraine, and you just heard about that in the CBN news update. How serious is it? Are we taking the situation seriously enough? Is there anything we can or should be doing? That's our conversation later in the program. But now, the debate over masks, vaccines, and lockdowns is not simply a debate over what should be, but we can't seem to agree on what is. Part of our conflict is the lack of agreement over what the facts are. One of the key questions is how many people are dying from COVID rather than with COVID. When CDC Director Rochelle Walensky was asked this question over the weekend, she said, the data will be forthcoming. Why do we not know that already after 2 years? Even the Supreme Court seems to be struggling to understand what the facts are. During oral arguments on Friday, Justice Sonia Sotomayor had this to say.
We have over 100,000 children, which we've never had before, in serious condition, and many on ventilators.
Now, when asked about the figure that Justice Sotomayor referenced on Friday, here's what CDC Director Walensky had to say.
The most important thing we can do for those children to keep them out of the hospital is to vaccinate them and to vaccinate their family members around them.
Understood, but the number is not 100,000. It's roughly 3,500 in hospitals now.
Yes.
What are we to make of all of this? With me now to discuss it is U.S. Representative and Dr. Greg Murphy, who is an actively practicing physician and a member in good standing of the North Carolina Institute of Medicine. He represents the 3rd Congressional District of North Carolina and is a member of the House Education and Labor Committee and the GOP Doctors Caucus. Dr. Murphy, welcome back to the program.
Good afternoon, Joseph. Good to see you.
It's good to see you. First, I don't know if you had a chance to listen to the oral arguments. Do you have any thoughts to share about the Supreme Court's long conversation on Friday and what they may do?
Well, it's going to be interesting to see, Joseph. I do think that this goes in the favor of saying that these mandates are unconstitutional. I've said that for several months, just simply on the basis of what they've done. They're trying to use a vehicle that is not correct. It's unconstitutional in what they're guard. And Joseph, the crazy thing is they knew this beforehand. And even Biden admitted this. He says it's probably not constitutional, but we're going to go ahead and do with it anyway. And so that's the difference between, I think, this administration and other conservative administrations. We actually look at the law first and then see what we can do afterwards. They just do what they can and then hope it's lawful, and oftentimes it's not. So I think they both get thrown out. It'll be very interesting to see how it goes, what the split is.
Well, to that point, the Biden administration all but said, we know it's not legal, but we think the threat of it is going to help people get vaccinated anyway. Do you think that's true? Have they won that bargain they made?
Well, I think that was their intention, Joseph. I think they wanted to threaten and bully and shame people into getting vaccinated. You know, I've been very clear from the front, Joseph. I've read the science, I've read the literature with great skepticism, because that's what we're taught to do as physicians. And I believe that these are safe and effective. But unfortunately, number one, we're not going to vaccinate ourselves out of this problem. This virus is just not going to go away. And two, this is not how you get people vaccinated. You don't shame them. You don't bully them. Look at Japan, for example. They have 78% of their people vaccinated, and they did this through education. They did not do it through mandates. They did not do it through bullying or shaming. And this is actually how we affect change, not by trying to make people a second-class citizen because of a medical decision that they make.
I think that's a really good point. This is just kind of human psychology 101. One of the worst ways to persuade somebody is to refuse to ask their questions and shame them for asking questions. But that does kind of psychologically seem to be the approach that the administration has taken in so many ways. Now, one issue that came up over the weekend with CDC Director Walensky was this difference between from COVID and with COVID. She was asked directly, what's the difference? How many have died from and with? And her response was essentially, we'll get that data to you later. We're essentially 2 years into this. You're a physician. I am not. Is that data hard to come up with? Or is there some reason that we don't have an answer to that question that's pretty direct?
No, Joseph, it's not hard to come up with. You know, at the beginning of this, the CMS, the way they qualified admissions diagnosis was based upon COVID, whether somebody had COVID or not, and the hospital got certain payments for this. And, you know, I look at our institution, and I'm still a practicing physician. I look at our institution. I was talking with our hospital president the other day, and I saw an alarming rate of positive tests that have come back really within the last week. You know, 3 or 4 weeks ago, anytime anybody would come in the hospital or need a procedure done, they got a routine test, whether they were symptomatic or not. The positivity rate was 7%, you know, 2, 3, 4 weeks ago. It's now gotten up to 40%, 40%, the vast majority of which are asymptomatic. And that's what we're seeing. We're seeing so many people who are carrying this very infectious variant, but not being symptomatic. So I think this data really is very, very easy to come from. You know, if you died from a heart attack and you were COVID positive, the COVID didn't call that. Or if you died from a ruptured gallbladder, COVID did not cause that.
So what's your response professionally to this idea that the positivity rates were 7%, now they're 40%? Is that something we should be panicked about?
No, I don't think we'd be panicked about it. You know, what we're seeing, and I feel for my colleagues who are nurses and physicians and other allied health staff who have been, you know, being just true heroes, rather, over the last 2 years, taking care of people. Our numbers are up. Our numbers are higher, actually, in our healthcare system now than they were during Delta's peak. That said, the numbers in the hospital are higher. The people in the ICUs and the death rate is not higher. And that's the goal. That's the silver lining in all this. People are sick. There's no doubt about this. People are sick and in the hospital, but the people who are actually dying, fortunately, are not proportional to the individuals that are coming up. And as even Walensky noted, 75% of the individuals who have passed away from COVID have not 1, not 2, not 3, but 4 comorbid conditions. These are obesity, hypertension, kidney disease, diabetes, advanced age. And so these are factors, these are things we actually know now. So saying that we don't know who's died from it and died with it is nonsense. It's just that data is there.
Then would that data create the term I think is called vaccine hesitancy? Is that why we don't get a straight answer to that question?
Well, I think that's the result of this, Joseph. You know, we've seen so many flip-flops from the CDC, the FDA, the Biden administration, and good Lord, Fauci, that it really has undercut people's confidence in doctors and in vaccines. And again, you start bullying people, you telling them what to do, they're going to get their spines up and not do that, which is just a very, very unfortunate thing. Yeah. You know, I've said many times we've been building a plane while flying it. I mean, this is true. We've been learning an entirely new situation with a novel virus. The problem is people haven't been honest about this. You know, Biden said he's going to come in, he's not going to crush jobs, he's going to crush the virus, which was just a flat out lie. I mean, this is what's turned out to be. It's going to decide what it's doing on its own. And the problem is Fauci's turned political, Walensky's turned political. You know, she was making school recommendation policies based upon what school board folks, or not school board, rather, their lobbyists and their unions wanted to do. So this is what's destroyed Americans' confidence in these very august institutions, or previously august institutions, of the CDC and the FDA. And so, I understand why people are very hesitant to believe what's coming out of this administration and its subsequent agencies right now.
I want to talk a bit more about the CDC response to this and play a clip from an interview that Director Walensky had. She was asked by NBC's Savannah Guthrie about the CDC's updated isolation guidance.
Why is the guidance so confusing? And I just have to say, the American Medical Association said the new recommendations on quarantine and isolation from the CDC are not only confusing, but are risking further spread of the virus. How do you respond?
Yeah, very important. Thank you for the opportunity to clarify. So for many months, years, we had isolation and quarantine guidance that said 10 days, and we are now standing on the shoulders of years of science.
The guidance is changing. What do you make of the changes? Is it science? Is it politics? Is it a combination of both?
It's a combination, Joseph. And if she's standing on the shoulders of science and what we've learned from the virus, why couldn't she stand on the shoulders and tell us what the death rate from true COVID was? So again, it's the particular politically motivated selection of certain facts here and not other places. But look at what the CDC has said. They said if you're positive, 5 days later you can go back, and you should not get a test. But if you do get a test and you are positive, then you need to isolate. So is that so confusing to people, or what? Again, it undermines the American public's confidence in our medical institutions.
1 year ago, 53% of Americans said COVID was their top issue. That number is down to 37%. And 68% of Americans say economics and inflation being a big part of that is now their top issue. Does that change in the public's priorities? Is that going to have an impact on how the White House continues to respond to COVID?
Well, Joseph, how this White House responds to anything is puzzling to me. I think they're tone deaf in so many institutions, or so many rather, issues that are affecting our country. Yes, COVID is here. It's still going to be here. And in my opinion, it's going to have to mutate to a form that becomes seasonal, that becomes really a somewhat of a smaller number of individuals that are bothersome, a nuisance illness, if you will. But what people are seeing with inflation that is knocking on their doorstep when they're going to fill up their gas or trying to buy groceries, these are the granular things that bother everybody, every day. It's in their face every day, while COVID may not be. And so I think the things are, wearing low as far as the people's patience on the Biden administration with COVID. And now institutions, people rather, are learning or getting more involved and understanding more that inflation and some of these other issues are really what we need to be focusing on an everyday basis.
Representative Murphy, thank you so much for your time today. We are out of time. We'll talk to you soon.